So, shall we start, sir? It's already 5 o'clock.
What?
Three, two, one.
On hypertension, a growing burden in the Indian population. As in the inaugural episode of this hypertension awareness initiative, I'd like to remind everyone that May is regarded as May Measurement Month. The 17th of May is regarded as World Hypertension Day as recognized by the World Hypertension League. It's been celebrated such as an awareness initiative since 2006. So we enter this month and as an initiative by the Integrated Health and Wellbeing Council, powered by Servier Pharmaceuticals, I'd like to kick this month off by having this lovely session. I am Dr. Sama Akbar. I'm an interventional cardiologist from Chennai. I also serve as the director of ICMR Hospital, which has always been a preventive and well-being center. And we have our speaker for the day, who is none other than Dr. Parindran P. Mohanan. Prior to joining as the principal of Ernakulam Medical College, he was the director and head of the Department of Cardiology at Westford High Tech Hospital, Thrissur, Kerala. Dr. Mohanan, sir, has been actively involved in medical associations and societies throughout his career. He has participated in several clinical trials and research studies and has many articles and papers published in peer-reviewed journals over the years. Sir, it's a pleasure to have you here today.
Thank you. Thank you.
Yes, sir. I just give a brief with regards to basically the growing burden of hypertension. Nearly 1/3 of the world has this silent killer, that is hypertension. Of them, nearly 50% of those
What happened? Seventh, is there any technical issue?
So we are just checking. I believe it is some technical problem and the moderator will be back. He's back. Yes, sir, please continue.
Yes, so as I was mentioning, there is a growing burden of hypertension and nearly 1/3 of the world is suffering from this silent killer, which is hypertension. And nearly 50% of them are unaware of the condition. And of those who are aware, only 1/5 of them are properly under control. So without further ado, I'd like to ask our esteemed guest and speaker for the day, Dr. Mohanan, to take over and give us his insights as to how hypertension is becoming the new pandemic.
Thank you, Dr. Akbar, for your fantastic introduction and the kind words. And the correction being, there are too many Mohanans around. That's the problem. No? There is another VP Mohan with the principal. Don't worry. Don't worry. I'm going to talk about as Sama was mentioning about the growing burden. So not long ago, to be precise, maybe about 90 years ago, the BMJ editorial, and mind you, that was John Hay from the University of Liverpool. He said, the greatest danger to man with high blood pressure lies in its discovery, because then some fool is certain to try and reduce it. Our knowledge of hypertension was pretty bad those times. And this is evident. I'm sure all of you will remember Franklin Roosevelt in the middle. This was the Yalta, 1945 Yalta conference, when the Allies were winning, Hitler was losing. They were discussing about how to divide the post-war territories. And you can see Stalin, Roosevelt, and Winston Churchill, the most powerful person on earth on those times, 1945. Mind you, all of them died of hypertension, hypertensive complications. Poor Roosevelt died 2 weeks after the Yalta conference. Stalin went on to live after 80 years after the Yalta. And of course, Churchill, he lived a little more, 20 years after the Yalta conference. Every one of them succumbed to hypertensive complications, heart failure, stroke. But then this was the President rules blood pressure at that time. Something like 300 over 190 was his recorded blood pressure. But there was no medication, and the understanding was poor at those times. Our understanding came much, much later in the 60s, in the 70s, even though we have been knowing about the right from the 1900s, when the Life Insurance Corporation thought that people with higher blood pressure are not living longer. They have been cautioning us. But the guidelines and all the others, the drugs took a longer time. And I'm not going to talk to you about that. And of course, over the years, right from 77, when the first ANC came, we have been having changing definition over the years. But as Akbar was stressing on that, hypertension is the most important treatable risk factor for cardiovascular disease. And unfortunately, the prevalence of hypertension in India is on the bound and on the increase over very, very many years. So this is an older data from Manchala, who did a fantastic work 80 years ago. And you could see that this was 25% at that time. This was something we did a few years ago. And this was done on the World Hypertension Day. And we could estimate the blood pressure of more than 130,000 people in a single day all across India. And this was our information. The overall prevalence of hypertension in India was a huge 30%, which will possibly translate into 1.4 billion is a little, this is a little earlier, about 3 years ago. So it may be a little more than this, but 234 million hypertensive in India. So this was one of the studies that we did, the Kerala risk factor, coronary risk factor study, where we've also found that now the prevalence of hypertension is 28%. This was Dr. Gupta's data. Gupta has done a quite lot of Rajiv Gupta's. We have almost 5 series of hypertension data from him. And this was the USA data. You can compare that. We are just inching upon these guys. And the control part and the treatment part is something which we have to be improving like anything. This is again something older data. I will show you what is happening right now in 2022. We have some data, but even then, we have been absolutely, and whose fault is this? That is something which we can discuss at length. But one of the most alarming thing that we found on that particular study was, look at that. Now, this is the overall hypertensive awareness, and this is the young hypertensive awareness. Young hypertensive meaning 20 to 39 years. Look at that. It's a dismal awareness, treatment, and control of the young hypertensive. And every time we say India is a young country, look at that. If somebody is 25 years is developing high blood pressure, He has another 40, 50 years to go by. The amount of complication that he's going to develop is phenomenally high. We don't know why the youngsters are so much of careless in their treatment and control, but then that is something which we have to be absolutely concerning about. I was talking to you about the poor control of every one of us were worried about the poor control of hypertension. And the danger is the treated uncontrolled hypertensive, treated, mind you, but uncontrolled hypertensive has a 74% higher cardiovascular disease risk rate. Look at the hazard ratio. I'm not, giving you, scaring you, but then that is the status of our country, and we have to be, every one of us has to be bothered about. I don't need to tell you about the importance of hypertension mediated HMOD, mediated organ damage. Every one of you are aware of it. But then this is another problem of us. Hypertension and diabetes are very close cousins. Tweedledum, tweedledee, you may say. And we always say we are the diabetic capital of the world. And when it combined with the deadly hypertension, it gives you a phenomenal cardiovascular disease incidence. This is something which has come very rather recently. Now, this is the age standardized. I think the RSSDI has come out with this particular data in 2021-22, and you could see that there is a lot of heterogeneity. There is a lot of difference in each state is different. That is our problem also. We are a big country, and unfortunately, there is no uniformity in the. Basically, because we don't have a national surveillance registry of hypertension or diabetes, but we know diabetes and hypertension predisposed to cardiovascular disease through its very many pathophysiological way. Again, I have no intentions to bore you with all this pathophysiology. Again, CKD, advanced CKD is another one of the important problems of untreated, uncontrolled hypertension, not to speak of hypertensive heart diseases, hypertensive heart failure, and the importance of hypertension in the genesis of coronary artery disease, which is the scourge of the century, the scourge for the world, scourge for especially for India. So, I mean, I've been scaring you with the stroke rate and CVD rate, but then we also have important information. There is no positive data. No, we have important informations. The sprint was one of those very wisely done studies, which again gave us an idea. See, if we control the blood pressure, especially more aggressively, you stand to gain substantially. If you look at the rather special features of hypertensives in India, we know that hypertension occurs at an earlier age. There is definitely a continuing rural-urban divide, though it may vary in some of the states. For example, in my state, it's more of a rural. There is not much of a divide. But there is always a clustering of multiple risk factors: diabetes, smoking, coronary artery disease, CKD. The blood pressure has been rising, and unfortunately, the awareness, treatment, and control, which are the most worrying thing for us, is on the increase. It's also interesting to note that the Indian hypertensives are sympathetically overactive. One of the ambulatory blood pressure control studies done at Delhi and all over India has shown that the average heart rate of an Indian hypertensive is higher. It's almost 72 or 73, which is compared to the other part of the world, it is on the higher side. Again, this is information which you are aware of. The population attributable fractions of, now, if you look at the very many risk factors of coronary artery diseases, 1, 2, 3, 4, 5, 6, 7, 8, 9. I mean, you are aware of the Inter-Heart study. Professor Salim Yusuf study, who talked us about the 9 important risk factors. For hypertension also, now we have been discussing about the multiplicity of risk factors. And when it comes to multiple risk factor, 1 + 1 is not 2. It is multiplicity. It may be 1 into 1, which may mean 3 or 4 or 5. I was talking to you about the very many guidelines. It's believed if you weigh all the guidelines available for hypertension, it will be more than 250 kilograms. Anyway, forget about that. But there is no paucity of the guidelines available for hypertension control. And this is the last guideline. The International Society always has also given. There is there is clarity on definition of hypertension, the treatment at which we have to bring it down, and the continuation of hypertension. There is and the treatment part, how to begin the treatment, which way, where you have to give a 1 drug or 2 drugs. There are no confusions at all on that. Unfortunately, what is people have been more debating whether these guidelines, mind you, we have an Indian guideline also. The 4th edition is on the running, the 5th is on the anvil. So whether it is applicable to us, it is definitely applicable to us. I do agree that over the years, the definition of hypertension values are changing. We are getting lower and lower values, but then that is important for us also. The new guidelines have borne for the Indian hypertension because now look at the proportion of the Indian hypertension that we have. We have a high prevalence of it, and we have a poor control. And there is a massive gap in the hypertension management in India. So, I mean, you can start from whether there could be very many reasons why there is so much of poorer control in countries like the most populous country like ours. Despite us being the most populous country and South Asia being occupying 60% of the world's population, there is no special mention about pharmacotherapy target for the South Asian population. Maybe some point of time we will correct it. But then the ESH and the ESC has given us the newer concept. They are not newer concept, but the importance one has to be given to the blood pressure management, and the importance of less conservative treatment, BP targets in the older and very older patients. And of course, the importance of target organs protections and the importance of why there is a poor adherence of drug therapy in our people, and the important roles of non-doctor population. Now we have our own data, not our own, but plenty of data from India also. Anchala, Prabhakaran, and all the CCTC, Public Health Foundation of India, they have all shown us data which shows that the non-doctor involved, the nurses population, the pharmacist population also has to be involved in the management of hypertension, because it's such a huge problem. Just a word about the importance of screening. Ideally, now after 18 years of age, now we have to be measuring about blood pressure in even. You may ask me how feasible it is, but then these are the recommendations, and I think our country being one of the area which is suffering most from hypertension, I think this definitely should apply to our population, and we should giving emphasis on the accurate measurement of the blood pressure. And again, I don't want to spend too much of time on that, except to say further again, every 2 year or 3 year, the world body come out with how to measure blood pressure. We continue to measure it badly, but then we have to be paying attention to the measurement of blood pressure in whether you use any sort of methods. We will touch upon the methods of blood pressure measurement in a minute. But then this is something which, when it comes to, because our problem has been the the large number of persons we had. So prevention becomes absolutely important. And here, now, I don't need to tell you about the life factors importance, like low physical activity, importance of tobacco. Fortunately, the tobacco consumption, the smoking part is coming down, but the non-smoking tobacco and the importance of atmospheric pollution. I'm sure all of you are aware of the fact that atmospheric pollution is one of the important risk factors of hypertension. We have again data from Prabhakaran and his group. We just mentioned about the dyslipidemia, I mean the diabetes part. It's equally important. As we mentioned, the multiplicity of risk factors in hypertensive population. The diabetics population, the metabolic syndrome population, dyslipidemia population. So look at that. When you have one risk factors, it attracts the other risk factors. And finally, the importance of social determinants, like the low education, low economic status, mental health. So these are all becoming increasingly important, and we have more and more data coming up on the importance of social determinants in hypertension. Then there are very many initiatives from the government of India and others, and that has also paved the way. I will show you the data, the newer data of how we have improved in awareness control of hypertension in a minute. I was talking to you about in the digital age. Now the hypertension measurement has changed substantially, and COVID also helped us in that way, that we have very many wearables, devices, and whatever maybe the devices that you use, see that the measurements are accurate. I was mentioning you about the India Hypertension Control Initiative. Now we have data across at least 17 sites in India, and from the collective efforts of this initiative, which began with the World Health Federation initiative, you could see that now. This is the recent publication, February 2023, and you could see that even though it is not the best results, and even though there is so much of variability in the very many studies that we have across India, we are showing some signs of improvement in our control of blood pressure, hypertension, which is a very good thing. Now, this is just this is the last study with about nearly 18,000 patient study, which has shown again the huge differences amongst the state in awareness, in treatment, and control. So, as I was mentioning, India is a heterogeneous state, large country, and with so much of differences. But finally, this is the current data of awareness, which looks much better than what we were in 2010. From 36%, we have gone up to nearly 60%. Of course, we cannot compare it with the enhanced data, which is something like 75 to 80%. But we have shown improvement. And in the treatment also, from 30%, we have improved from 30 to 43. Much below par. And I'm not saying this gives us an occasion to pat our shoulder and said, I'm not in a self-congratulatory mode, but from 16% or 15% control, we are inching on to nearly 30% control with the collective effort from the government, the private players, and everyone. As a healthcare professional, we know now there are patient-related inertia and healthcare system. Our system is still, the system has to be much better for control of the non-communicable disease. No questions asked about that. But then this is beyond our control. As physician, as an individual clinician, we should avoid clinical inertia, which is again one of the most important factor in the poor control of hypertension. Mind you, we have just reached 30% control of hypertension. A huge 70% of our population is still not on control. And suboptimal antihypertensive therapy should be avoided by every one of us. So this is my last slide, my dear friends. It is the commonest treatable cardiovascular disease risk factor. And hypertension management over the years has improved from 2010 to 2019 to 2022. We have shown data which showed that there is a decent improvement in the awareness, control, and the treatment pattern. And especially encouraging is the largest improvement in the BP control among the socially disadvantaged group, the educationally backward group, and the poor economic group. That is again something which now we have to be specifically looking for. And now, of course, the government of India has also launched the world's largest health insurance scheme. And I believe and I sincerely hope that all the collective effort will improve the hypertension control in our country. Thank you for your kind attention.
Thank you, dear sir. That was comprehensive. You've summed up every single facet with regards to diagnosis, awareness, prevention, and complications, especially eye-opening factors such as the fact that hypertension is a silent killer, not just in the oldies, but in the youngsters. Something which people of my age group and people much younger to me. In fact, there was a study which I came across in Delhi. They did it across. They did a hypertension screening for 7th graders up to 11th graders. You're talking about teenagers, and they found about 22% suffering from hypertension, and nearly 40% of them having obesity. So these two are non-communicable diseases, and we should be more on the lookout to nip them at the bud. Because if you let them grow, they're definitely going to maim us, then kill us. So it's something which we should all keep our eyes and ears open about. Just before you go away, sir, I'd like to ask you, what is your point of view with regards to home-based blood pressure monitoring?
I think, again, we don't have too much of data on that. We have some data on ABPM in use in India, but HBPM, the home blood pressure management, which possibly, and again, that was one of the advantages of COVID, which now everybody are more used to devices. It should be more popularized, and we should be again spending substantial time on how to accurately measure blood pressure, use the home blood pressure, and then validate it. See, the most important thing is validation of these HPPM, which I'm sure will happen in the next few years. I'm sure about it.
Absolutely, sir. To sum up, we've touched upon the fact that it's a silent killer. It's basically the tip of the iceberg, which we are seeing. The submerged portion still is a large number. We're in the right direction. As sir had mentioned, we hold the Guinness Book of World Records for screening the most number of patients for BP in a single day. That was done by our lovely friends of the CSI Society, and Mohanan sir also was a major part in that. And in fact, every specialty, when they walk in, instead of just registering people, we should probably mention the blood pressure next to their registration number in their OPD. As far as economic loss because of hypertension and its awareness, sir had mentioned CKD, myocardial infarction, heart failure, and also strokes, causing a huge economic loss and days of activity lost because of just hypertension being a risk factor. We've spoken about young hypertensives and every single facet of how we should try and nip it at the bud and come out a much healthier, stronger, and happier India. I'd love the session, sir. Thank you for gracing us with your presence. And I'd like to thank Integrated Health and Wellness Wellbeing Council and our sponsor and power, that is Servier Pharmaceuticals, for making this May Measurement Month a real eye-opening initiative. I'd like to sign off for today. Thank you, sir. I hope we meet in future gatherings. Nice to have your time, sir. Thank you.
My pleasure. Thank you.